I'm Dr Hinnah Rafique. I'm the founder of Generation Medics. We're a multi-award winning social enterprise that helps people from all social backgrounds to explore, strive towards and succeed in medical and healthcare careers. We have in-person events in local communities, so that could be after school clubs, holiday programs, or in community centres we run training. We do this for kind of children and young people, but also for adults. And then alongside that, we've got a fully functioning online platform which essentially has a virtual healthcare academy. So it helps take someone through the stages of exploring the 360 different roles available within the NHS and healthcare, finding the right fit for them, and then helping them with the application process. So kind of demystifying all the different bits you need to do, so references, supporting statements, and helping them to be successful in interview and ultimately in their roles in the future. I personally started it because I have always wanted to be a doctor, and actually it was really difficult. I went to a state school and I couldn't get the advice that I needed. My teachers were really kind of open and transparent with my parents, saying there's no one from our school who's kind of gone on and done that. We don't know how to help your child to get to where you want to go. I was lucky in that I had a mentor who knew something about applying to university, and I managed to get in. And I absolutely love my job as a doctor, but I do think that the circumstances a child are born into should not limit them from fulfilling their potential. And yet when we work across the country and we see in some communities that when you go in and ask a group of school children who works in the NHS, they'll struggle to get past doctor and nurse. But like I said, there's 360 roles available. It's not just going and doing a degree. You can go get in through the apprenticeship route and also entry-level roles as well. There were some challenges around, well, why is this needed? Is it needed? From the kind of NHS seniors that I spoke to at the time. But actually, when I went to the people that we're trying to support, the need was really clear. We had thousands of schools signed up in the first year, and actually we kind of went backwards. So instead of going to healthcare first, we went to the education system first, because we knew that there was a demand there and they were willing to kind of invest in supporting us. And along the way, so 3 years along the journey, I was appointed as the first female founder on the Clinical Entrepreneur Programme within NHS England, and that helped to kind of just raise our profile and meant that we weren't just supporting people to become doctors and dentists, but actually, we need more midwives, we need more paramedics, we need more nurses, and that kind of recognition from NHS England and them saying to us we need those people helped us to develop programmes for those different professions. So the Clinical Entrepreneurs Programme has been fantastic. So it's kind of provided practical advice on like how to pitch, provided connections. So whether that's kind of NHS CEOs or like really senior leaders within the NHS, people you wouldn't normally be able to speak to, kind of in the audience, just hearing about my innovation and the impact that we're having. It's also provided that kind of stamp of approval from the NHS that it's okay to be doing this. And I think that's one of the struggles that entrepreneurs often have. You've got a great idea, you can't progress it through the NHS, so what can you do? If you go and start up a separate organisation, some doors are closed to you, but the Clinical Entrepreneur Programme and indeed the AHSNs can help with supporting people with innovative ideas. Interestingly enough, I was a lecturer as well, alongside being a doctor, and I was funded to deliver a master's programme on healthcare innovation within the Oxford AHSN, and there I met kind of 30 to 40 clinicians, and we were supporting them over a master's programme, and I used my experience of having got something up and off the ground to actually say this is how I went about doing it, and it was fantastic to see just a small idea turning into something that actually was impacting thousands of patients.